We have a chance to talk with doctors on a regular basis here on 3+U, and always the strides being made in medicine are so interesting and amazing to me to be able to relate to you. So here we go again this morning, because we're talking about total ankle replacement surgery and how you can go home now the same day as your surgery. It's an amazing accomplishment. We're so happy this morning to welcome Dr. Christopher Lotufo on the show. He is, of course, with the Center for Sports Medicine. Who else? Nice to see you this morning.
Thanks for having me.
So you're able to do this with a day of release because y'all have this surgery center where you can now perform the surgery?
Correct. So the ambulatory surgery center is an outpatient center, and the ankle replacement can be done now simply outpatient. The patient comes in, they get a block, so their leg is essentially numbed from the knee down. The surgery itself is done under general anesthesia, but with that block, it keeps them pretty much pain-free for up to 24 hours, and they're able to go home the same day.
So what necessitates a total ankle replacement? Is it an arthritis concern, or is it a frailty concern?
It's mainly an arthritis concern. Similar to hip and knee replacements, the joint and the cartilage within the joint eventually wears out. The difference with the ankle is usually it's due from an injury. So somebody sprains their ankle several times, or they get an ankle fracture. It eventually heals, but it leads to wearing away of the cartilage, and eventually you get bone-on-bone arthritis, which is very painful. So we're now able to replace ankles as versus fusing them, which is what we've done historically for many years.
I know you can't take us to medical school in a 5-minute conversation, but so you're literally going in, and when you do the ankle replacement, is your foot still connected to the rest of your leg in the same way?
Yeah, that's the nice thing about the newer replacements, is that the ligaments are all staying attached. We're simply cutting the joint out, so we're taking the bone part of the joint and the cartilage out, and then replacing them with artificial components. There's basically two metal pieces and a plastic piece that goes in between them, very similar to a knee and a hip.
So that's a big surgery. Going home the same day, what's a daily restriction like for patients after going through this kind of surgery?
So after the surgery, they leave basically in a splint. It's kind of like a half cast that goes behind the knee, behind the leg. And they're non-weight bearing, so they're not able to put any weight on it, and that's for up to about 4 weeks. So they're going home on crutches or a knee scooter or something similar to that to keep the weight off of it. But with the anesthesia that we do, they're able to go home and rest in their own home versus having to sit in a hospital. We still put some patients in hospitals if they have some other medical comorbidities or just to be safe. But most people nowadays can go home if they're relatively healthy.
You know, you were talking about the stability factor, that some people come to you often because they've had repeated injuries to that ankle. Once you've had a sprain or something, it just doesn't heal as easily as a bone will heal. So is that sometimes a reason to perform this surgery, to avoid future potential injury? Because a fall could then cause a broken hip, right?
Right, but not really an ankle replacement. That would only be done if the cartilage in the joint had been worn out. So we have other surgery that we can perform if they have an unstable ankle. So somebody who sprains their ankle several times, those ligaments will heal, but they eventually heal a little too long. And when they heal too long, you end up getting play in the joint, and you tend to sprain the ankle more often after that. If the cartilage is still healthy, then we can simply bring them back and tighten up those ligaments so they don't keep spraining their ankles. That's definitely preferable over doing a total ankle replacement.
That makes complete sense to me. So this really is driven by pain for your patients coming in.
Correct. When the ankle's worn out, basically you're walking bone on bone, and it's very painful. People can't be on their feet for very long. They get a lot of swelling. They get a lot of pain. They can respond to injections every now and then, or maybe a brace, but at some point something else has to be done, and that's either an ankle replacement or an ankle fusion. You
know, we're an outdoorsy, active town, so do you see this occurring in as many non-athletes as athletes, or does it tend to be kind of a runner's problem?
Well, the joint injury could be anybody, but the replacements tend to be people that are a little bit more sedentary. And the reason we say that is the ankle replacement only has a certain lifespan. And if somebody's really rough on their ankles, somebody's doing downhill skiing, or they're hiking rough trails, they're going to be better served with an ankle fusion so they don't destroy the joint. But you can still do, light hikes on smooth trails, golf, general walking, those kinds of things.
Right.
But we try to tell people to avoid anything that was really high impact that's going to potentially adversely affect the ankle.
You brought up a great point that I'm sorry I have not yet asked you, so I will now. What is the lifespan of this ankle replacement?
We're getting about 10 to 15 years out of them before we need to do something else. Usually the plastic piece in the middle will wear out. So after 10 or 15 years, sometimes we'll have to go in and replace that plastic piece. The metal pieces grow into the bone once they've been in there long enough. So hopefully if those are intact, those don't really have to be replaced. But the plastic piece will wear out over time.
That's a great lifespan though, 10 to 15 years. And I had asked you before we got on air how long this procedure had kind of been around. You said only about a year in Chattanooga, but the procedure first was tested and begun to be used about 10 years ago. So a lot of vetting here.
Oh, great. I mean, it's been around actually longer than that. They attempted to do ankle replacements back in the 70s, but the design back then was just not the technology. We didn't have it then, and they just failed. It wasn't until the late 90s in Europe they started doing more ankle replacements, and they got popular here in the United States in the early 2000s. But the newer generation implants have really made a significant improvement in the ability to put them in and reproducible. So they're now becoming much more popular. That's really about the last 10 years.
So for patients interested in learning more, does it all begin with just making a phone call to your office and kind of telling the person who answers the reason for the appointment, and then y'all will take it from there?
Yeah, definitely. We'll have them come in and we'll discuss their options. And as I said earlier, not everybody's a candidate for an ankle replacement. But if you do, in fact, have ankle arthritis and something needs to be done about it, a visit with us will be the first thing to do.
All right. Well, thank you so much for your time this morning. I hope that we didn't cause you to be late seeing some of your patients, but we sure do appreciate the education this morning.
Thank you very much for having me.
You can learn much more about all the different services they can provide at Center for Sports Medicine. Their phone number is 624-2696. Online at sportmed.com. Again, Dr. Lotufo will be happy to help you. He's kind of breaking ground on this new surgery and would love to see you at the office. We're back after this.